Good afternoon to everybody in the room and to all those online. I gather we've got quite a few of you online. And welcome to the All-Party Parliamentary Group for Cycling and Walking. The subject today is the NHS and Active Travel. And we've got quite a good panel for you today. The meeting today will explore how the NHS can support and benefit from active travel initiatives, highlighting their potential to improve public health, reduce long-term healthcare costs and create healthier communities. And as I said, we've got a fantastic range of speakers to cover this for us this afternoon. We've got Andrew Bradley, Sustainable Travel Lead for NHS England, Karen Janady, I hope I pronounced your name correctly, Karen, from the Oxley's NHS Foundation Trust, and Julian Sanchez, National Cycle Lead at the Active Wellbeing Society. Now, each of our speakers will speak for around 10 minutes, and then we should have time at the end for questions. Please put any questions you may have in the Q&A box if you're online, not in the chat box, and include your name and organisation, please. So let's start first with Andrew Bradley, and it is exactly 16:35. You have 10 minutes, Andrew.
Thank you very much, Fabian, and thank you very much for inviting me today to share with you a little bit about my experiences around the NHS and what we've been doing in the world of sustainable travel over this last few years. As you'll be aware, probably the NHS is the largest employer in the UK, and it's in the top 10 employers in the world with 1.4 million staff. So we are very important, really, in terms of the environmental agenda, but also in terms of the health agenda from our staff's perspective, let alone when you think about the number of people that we are influencing and working with up and down the country. So I'm going to talk a bit about where we've been, I'm going to talk a bit about where we are, and I'm going to talk a little bit about where we're going. Principally, I'm going to be focusing on staff. I hope that's not a disappointment or surprise, but patients and visitors inevitably benefit from the things that we're doing as well. So let's start with a little bit of journey back in time. Encouraging active travel, take up or indeed encouraging the NHS organisations to give active travel a great deal of airtime is, as you might expect, quite a challenge because it's a very busy space and there are a lot of conflicting and competing issues that they have to face. Back in 2022, I was appointed to NHS England, to the newly formed Travel and Transport team, and we had a new programme clearly focused on carbon reduction and environmental improvements. And transport is a key consideration as the NHS accounts for approximately 4% of road mileage nationally. So getting people more active, getting people on public transport, getting people cycling and walking is really important. What I found when I started with the NHS, and what many people don't understand, is the extent to which the NHS is a patchwork quilt of different organisations. To think that it's one homogenous lump that you can do what you will with is unfair, not true, and actually quite difficult. So for active travel, at least, I found when I joined that the central organisation that I was working with perhaps lacked some of the power that it needed to enforce change, or certainly the budget to facilitate it, which I know is in common with a lot of other sectors in terms of cycling and walking. It's a little bit of a Cinderella, a little bit of a thing that is thought about perhaps after other modes of transport. But what I also found, and this is where I will be encouraging, is that I found a lot of people within the NHS system who were very enthusiastic advocates for sustainable and active travel and were doing great things up and down the country. And that continues today. So got on with establishing the NHS's first sustainable travel network called Step Up a Gear. And we had, and we still do have, reps from up and down the country representing over 100 different trusts and ICBs, integrated care boards, and they represent all different specialties. So some of the people are clinical on it, some of the people are estates people, some of the people are transport people. It's a really good mix. And each of the trusts that originally joined the Step Up a Gear network took forward a specific intervention that they said they were going to use to try and embed a change in their organisation. So to give you an example, at Barts Hospital in London, they installed a series of Brompton bike hubs that staff could use to go and do their visits elsewhere and also cycle between the various hubs. It's been great. It's been really successful and built on a lot of work that was done with Brompton and the Help for Heroes campaign that took us through the COVID pandemic. So that's just an example. There were plenty of other examples, bike parking installed at various sites, trying to see what difference that would make, etc. So as part of Step Up a Gear, we have a how-to network. Each month we have a session in which we cover different themes. So it might be electric bikes one month, it might be about accessibility issues another month, it might be about rail the month after that. And what we do is we try and pick up the issues that are exacting lots of our colleagues. So where are the problems? How can we help? How can we support? And we bring specialists in from outside the NHS and we support them as well. And it's also a great opportunity for them to compare notes within the NHS. There are 3 particular themes that come up again and again at these sessions. The first is about cycle parking. Now, we all know about the back of the bin stalls kind of cycle parking arrangements that you'll see, and it's no different in the NHS. Quite often, cycle parking is pushed off into somewhere where nobody can see it because that's the easiest thing to do. It's where there's space, and a lot of NHS sites are about trying to get stuff into the space that's available rather necessarily than where people will actually use the cycle facilities, front of house, by the staff entrance. That's what people want. And I see time and time again that those are the cycle shelters that are used, not the ones that are shoved in the back and beyond. Second thing is about e-bikes. So charging of e-bikes within the NHS estate is quite a challenge. And I personally can't wait for legislation to come forward to be a bit more prescriptive about what is a safe to use e-bike and what isn't. I'll wait and see what happens, but our fire officers within the NHS do express reasonable concern about some of the less, some of the more dodgy, I suppose, batteries that are used with e-bikes. And so some trusts have actually they've said nobody can bring e-bikes into their estate at all. Now, clearly that is a challenge and a problem that we have. And the third thing is about accessibility. So here I'm talking about getting often relatively low budget measures off the ground. Things like benches. I'm not talking about complicated things here. I'm talking about actually providing for people to get across the site, into and across the site as best as they can, because actually to walk from a bus stop or a car park to the main entrance of the hospital, 400, 500 metres, can be a bit of a stretch for quite a lot of people. So can we provide for those people who need that? So that's where we've been. Where are we now? Well, the Net Zero Travel and Transport Strategy was published October 2023. And in that, there was a requirement for NHS organisations to deliver sustainable travel plans by the end of this calendar year. We're publishing guidance for the trusts and other NHS organisations that they can use. That will be published by the end of this month. And the strategies will be with travel plans. We're expecting that NHS organisations will produce those for all of their main sites, because we'll hear from Karen in a minute that for some community or mental health trusts, they might have as many as 200 sites, and expecting focus to be on all of those sites is just not possible with the resource that we have available within the NHS. We ask that they have smart targets within those plans. We ask that they have interventions in those plans that meet the needs of staff and patients and visitors, and that they respond to the data that they get from those patients and visitors and staff, of course. I'll just finish because I'm going to run out of time, aren't I? But where are we going? I'll finish with a couple of things here. The first thing is I want to say there are two elements which I think could make a big difference moving forward in the active travel space. The first thing is working in partnership. If we could somehow get NHS spaces included in the work that local authorities are doing with their LC WIPs, so local recycling and walking infrastructure plans, then that would make a huge difference to us. And in many areas, NHS sites, even though they're needed and used by everybody in a community, they're often forgotten, excluded, or not included because people drive to NHS sites, don't they? Question. And the second thing is about enabling people. So providing walking routes, putting bikes into the hands of people who can't afford them, sorting out the situation with e-bikes, and also providing pool bikes or loan schemes where people haven't got access to bikes. I think that would make a huge difference for the work that we're doing. So thank you for your support. Really appreciate it.
Thank you so much, Andrew. And thank you for sticking to your 10-minute slot there, because I want to have enough time for people to ask questions, both in the room and online. Our next speaker is Karen Jannedy. She's from the Oxley's NHS Foundation Trust, and she's going to give us 10 minutes. Thank you.
Thank you so much. Yes, you've got one slide. Let's start with. Thank you so much. Good afternoon, members, and thank you for inviting me. So I want to make the case about a very small-scale e-bike pilot in the south of London in Greenwich, which is primarily focused on supporting community staff getting to appointments. And this is actually a fair and low-cost and high-impact solution. Much of the messages that Andrew's shared already. So if you could move on to the next slide, please. So just a bit of context for us. Our NHS Foundation Trust Oxley's caters for patients in the community, in hospitals, in prisons, in schools, in clinics that are quite diverse. We've got about 4,500 members of staff, 70% of whom travel by car. That's what they tell us on year after year. Only 2% cycle, and under 2% cycle, and 3% last ever they walk. So it's a very car-centric culture, and because we have to travel great distances, and each year our staff accumulate over 1 million miles to go and cater for patients in the community. 3 out of 4 trips are for home visits to clients in the community. So it's a great challenge, and that challenge is 240 tons of CO2 per year, which is equivalent of 4.5 trips between the Earth and the Moon. So if we move on to the next slide, I'll tell you a little bit about the pilot. This in the picture here is Raj. Raj manages a team of community rehabilitation physiotherapists in Greenwich. He's got a team of about 30 people now, and Raj's team agreed to take on this pilot scheme for e-bikes. What we did is register it as a quality improvement initiative, and then tested the team for the very steep slopes that we see in Greenwich, so about 18 to 20% grades around Shooters Hill and in a hospital where they're based, so we couldn't just go for regular bikes. So we tried the e-bikes to make sure we could carry the load that our staff need to go and see patients in the community. We also installed some fire compliance charging and parking resources by the entrance of the hospital to make it attractive and easy, and then created a booking system and provided some training. So what does that tell us here, though, Ira? If you move on to the next slide, please. What we've managed to do is hit the triple bottom line of this project. So we looked at the holistic model between the planet, public purse, and people. We're improving the air quality and reducing car travel. We are enhancing productivity by proposing faster travel than they would normally do by car or by public transport. And we're also offering more agility for the workforce. From the user experience perspective, it's much more attractive for short trips than taking public transport in Greenwich. It's a heavily congested borough as well. But also what we found out in the registration process is that the participants to the pilot actually really wanted to improve their fitness. The environment was a less important, if you were, than their personal fitness, which I thought was interesting at the time. If you move on to the next slide, I'll tell you some of the results. So on the planetary health results, we've seen that in the first year we travelled 4,500 miles in the first year, which is about 2 tons of CO2 avoided compared to an average petrol car. In the second year, we're looking to double that. And in fact, in the first 8 months of the year, we've already travelled 6,500 or almost 6,500 miles. That's 2.7 tons of CO2, which is equivalent to 10 return flights to Edinburgh or powering an average household with electricity for a year. So it's a very hopeful situation. If you move on to the next slide, I'll tell you a little bit more about the productivity aspects. What we're seeing is that the Greenwich Neuro team here is seeing more patients per day, or so it's more patients in general than per month, than they did before the e-bike pilot started. Now, this is not just about the e-bikes, it's also about regaining focus on reducing waiting lists in the NHS. However, what's very positive is that we can see that the team went from 29.22 to 33 members of staff, so they've got an increased workforce. However, their travel costs are decreasing. So we're helping them reduce their revenue costs from travel while increasing the number of patients seen. So at the very least, the e-bikes is supporting increasing productivity for the NHS and increasing the patient contact, which is really great news. If we move to the last slide, perhaps one of the really amazing outcomes that the outcome on people. Verona said that it's helped her use her time more productively. Anne has actually said that she sees more patients as a result of using the e-bikes, and actually Anne had lost her car when she used the e-bike for 2 months, and she saw more patients as a result of cycling that she did when she was traveling by car. Now, if you see 4 patients per day, 3 patients per day, and you add 1, that's 25% of your caseload. And then Raj said that he uses the e-bikes himself to go in between sites and have his appointment, because that avoids the parking, looking for parking, getting stuck in congestion, and also the parking fines. But what he has said that was really striking is that he uses the e-bikes as a way to, as an incentive for staff when they are being recruited during the interviews. So they mention it, and it's become one of these things that you mentioned that actually potentially helps recruit people in the NHS. And that is a big thing because the NHS is struggling with recruitment at the moment. So if we move on to the next slide, I'll show you a little bit about what we plan to do going forward. So we are going to carry on building trust in cycling and building the skills as well by socialising the e-bikes, taking them to different sites and trying to bring them as part of the model of reducing your carbon emissions and a better offer for staff. However, I think you alluded to it, Sandro, we're looking to get better guidance on charging and parking for e-bikes. If I give you an example around fire safety, we've got great concerns around batteries and fires. However, we had a fire in the hospital last week, but that was actually from the cleaning equipment inside the hospital, because most of our equipment, realistically, is moving to battery-powered. So the e-bikes is one more on the array of battery-powered equipment that we're going to be living with going forward. So we just have to manage it rather than cut it out. So it's an important thing to take forward, and we need more guidance on that. Finally, just to say around the equity, we're seeing that 1 in 3 miles are taken by staff on band 2, 3, and 4 going in the community. And these are the lower paid staff who actually are excluded from the salary sacrifice schemes. So they're now able to hop onto an EV salary sacrifice scheme, for example. So actually the e-bike is quite an effective and cost-effective and high-impact solution for them. One of the great opportunities, I suppose, is the NHS neighbourhood we have going forward, which is part of the long-term plan. So if we're looking to develop more community-based health for a preventative model of care, then that reduces the distances travelled and therefore makes the e-bikes for short trips much more attractive, and also potentially more attractive to our staff. And if I point to the image in the middle there, this is our nursing demographic, and we've got 50% of our workforce between the ages of 40 to 60, with we're seeing less nurses coming in, so we have a gap there as well. So we need to address that. Thank you. And last slide, I just wanted to finish on a really lovely quote from Rowena, which said that when she was applying for the job, she was told that there were electric bikes at Oxley's, and she chose to work for Oxley's over another job. So that confirmed the anecdote that Roger said to us earlier around the retention and recruitment of staff and the attractiveness. Thank you very much.
Thank you very much. That was well within the time. Thank you for that, and a very interesting slideshow there. So thank you for that, and thank you for Oxley's experience, sharing that with us. Really encouraging. Our last speaker is Julian Sanchez, who's the National Cycle Lead at the Active Wellbeing Society. Julian, you have 10 minutes.
Good afternoon, everyone. I'm going to talk to you today about free bike schemes and their impact on health, and specifically about a model that we have that provides free bikes to staff in pay plans 1, 2, and 3, those who wouldn't be eligible for the Cycle to Work scheme. So I'm going to talk to you about that. So the free bike schemes that we have are in Birmingham, Essex, and the London Borough of Ealing in Southall. And together we've given away around 13,000 bikes. And I say free bike schemes, it's actually a loan to give away scheme. So it's actually a sort of contract with the participants. So what happens is that mainly in deprived and underserved neighbourhoods, we effectively target free bikes to those people who otherwise wouldn't be able to afford one, and don't have access to a bike, essentially. And what we do is we provide a really nice brand new rally bike, and it either has a GPS tracker on, so we can gather data on trips, of origins and destinations, how people use the bikes, active minutes, which is all very useful, or we encourage people to download the Let's Ride app. So they get the bike, we collect data, and then also we give them a helmet, a pump, a lock, so that they've got all the kit to be able to use the bike. But essentially, it's offering wraparound support. So we're focusing on people who were previously inactive in the most deprived areas, so people who are experiencing the social determinants of health and health inequalities. And we're giving them training, we're giving them led rides, events, support, so that we can encourage those people who previously weren't participating, they couldn't afford a bike, they were inactive, or alternatively, some of the lowest paid hospital workers. We're encouraging them to take up cycling. And this really massively opens up the sort of travel horizons of those people who get to receive a bike. And it starts to help with that sort of culture shift and encouraging a culture of cycling, either at a neighbourhood level, but also to work and to key workplaces such as some hospitals. And we often call the participants the unusual cyclists because it's a very different demographic. You know, we talk about democratizing cycling. We talk about the way that we can increase reach and try to get more people active in cycling. And the projects we have really do achieve that. So we've got more women cycling, more people from different backgrounds, more children cycling as well. And so what we're seeing are some really interesting impacts as a result of this. So we've recently had an independent evaluation by the Altera consultancy. We've got an impact report on our website, the Active Wellbeing Society. And what we're demonstrating actually is a return on investment of £12 for every pound invested, rising to £16 over time. So taking those people who are the most inactive and enabling them to develop a new cycle habit, to build cycling into their everyday routines, it just becomes a normal part of everyday life as a way of getting around. There are really significant benefits for the individual, for the community, but also system-wide benefits as well. I think this can have potential. I mean, this is already proven to be saving the NHS millions in the areas where we're operating, but it could potentially be really significant as part of the wider prevention agenda. And if we link this to work in neighbourhoods, this work in the health system, but also more widely to community regeneration and projects like Pride in Place, if we can link that, then I think there is huge opportunity for more savings, more activity. But fundamentally, it's about the partnership working with the people involved. It's not just about, oh, there you go, you've got a bike, get on your bike. No, it's about giving people support, building up small groups, building up community cycling clubs, building up a social movement. And actually, what that does more broadly, it increases the visibility of cycling in those areas. Actually, all our bikes are orange, they stand out. And the projects like Big Birmingham Bikes and Essex Pedal Power, Let's Ride South, within them, there's this sort of sense of real pride in the community. So not only are we trying to tackle inactivity and reduce the risk in terms of the burden of disease, and we've got evidence to absolutely demonstrate that with reductions in risk in terms of heart disease, cardiovascular disease, stroke, and some cancers. We've actually got that evidence to do that. We're actually demonstrating and kind of modelling a behaviour that anyone can do. So cycling really does become an activity that's suitable for everyone. To talk very specifically, briefly about the hospital scheme. So it's we've had a pilot at Basildon Hospital where we've given over 350 bikes away to staff in pay bands 1 to 3, and this was very much to address the cost of living crisis. Really, there's evidence to demonstrate that it's helping with retention of staff, but also as a helping with recruitment as well. And I mentioned at the beginning that we have collecting data and trackers, and this relates back to a point that Andrew makes. It's really important with the local cycling and walking infrastructure plans, all the work that local authorities are doing around the country, that they actually have real data about how people behave, where they go from and to, and how we can support infrastructure and how we design infrastructure. And just a very quick win from the scheme at Basildon Hospital, just as a result of collecting the data, we've got a lovely dashboard about the trips. It was very apparent that there were some things lacking around the hospital. So we were able to work with the local county council, Essex County Council Highways team, to identify where there's some gaps in lighting on the way to the hospital. And that was quite a quick win. We were able to improve that, as well as improving cycle parking. So really excitingly, a couple of weeks ago, we launched a pilot in Birmingham. So as part of the next iteration of Big Birmingham Bikes, at the Heartlands Hospital, we've just given away 50 bikes to hospital staff, similarly in pay bands 1 to 3. And our ambition really is kind of to build support and ideally have a national scheme where we've got the two models working together at a community in the most deprived areas, helping to deal with health inequalities, but also reducing the burden of disease, so that prevention agenda and linking much more broadly in the system, but also the hospital model where we can provide bikes to more hospital staff. And the way we work is we work as a sort of network, and we have an opportunity to purchase bikes in bulk through that network for partners, whether they have the community scheme, but also the hospital scheme. And we're able to actually get a really good bike package, so it becomes really cost-effective way of supporting those staff and those communities. And there, you know, with the whole plethora of health, well-being, and community benefits that accrue and develop. And just one last thing, one point I want to make is that there is a lot of investment in infrastructure, and that's absolutely fantastic. And Active Travel England are doing a really fantastic job with local authorities and mayoral combined authorities. But what we must say, and the evidence we have from our impact report demonstrates that infrastructure isn't enough. You know, if you really want to get the benefits of that investment, then think about some of those cohorts, low-paid workers, poorest and most deprived community, make active travel, make cycling available to all of those people as well. And that represents a very good investment by the state. Thank you.
Thank you very much indeed, Julian. Thank you to you, to Karen, and to Andrew for your excellent introductory remarks. We've got half an hour or so, just slightly less, for questions and hopefully answers as well. I'm going to start off in the room. Are you leaving? Shane, no, thank you for being with us. Yeah.
Well, really interesting to hear. I sort of look back to my time as a Wiltshire councillor when I bought myself an e-bike. It was a particularly good one. Still got it actually. So it was a cheap one. So I had a range of about 20 miles, which I needed to use because I lived about 18 miles from the the headquarters of the council. But they did have a room at the back of the council, which was 4 bikes. It was locked with a code to get into, and there were plugs, so you could plug it in. So when you wanted to come home, voila, you had a full e-bike to cycle home on. But the questions really are around theft of e-bikes, and this is really open to all of you. Taking home the e-bikes. So for yours, of these bikes that you've got for work, are they just from work? Or take it home and all of that. So what are the range of the bikes that you've got? So after
Shall we deal with that question first, and then maybe take 2 or 3 to go? Karen, do you want to come back on that?
Sure. So the bikes that we have are being leased. So we've gone for a lease model with a company called Dash Ride, and they insure the bike wherever it is locked to an immovable object.
Okay.
So we can take it outside of the patient's home, lock it to a lamppost. That's acceptable as long as it's under 24 hours. So as long as the bike is securely locked for somewhere, it's insured. So but in 2 years, we ran one theft, and that's when a member of staff took the bike home to go to the next appointment the next day, and he stayed, actually ended up staying there for 2 days, and then they went. So that was very early on, and then we did specify, please bring the bikes home. The reality is, these schemes can't be completely, scrutinized, if you will. And I see a lot of the staff taking the bikes home to be able to get to their first appointment. And I think that agility is actually really what matters, because you're not going to come back to work and then take a car or then take public transport. That really makes your day a lot longer.
Yeah.
You need to be very agile. So I'd vouch for staff being able to take it home if there was that flexibility in providing resources. Now, people with own bikes, it's a bit more complicated around the quality of the batteries, how they've been looked after, etc. So in a way, having that control of where the bikes comes from and sourcing gives us that assurance, if you will.
Mm-hmm.
Do you have trackers on those bikes at all?
We've got GPS trackers, so we know how many miles are being carried out, and when the one did get stolen, which, across 2 years, only one's very good. We found out where it was, but then we didn't know whether someone should strip the trackers at the bin, so we didn't.
Anybody else want to come back on that point before I move on? No, Andrew?
Just very briefly, it is a challenge, and certainly referred to the Step Up a Gear network, and some of the trusts that we work with did buy e-bikes to do similar work to the work that Karen's described, and it has been a problem. Theft has been a problem. It continues to be a problem, and even dressing bikes up in ambulance or NHS livery does not seem to dissuade thieves, who increasingly seem to steal to order. So it is something that I think have been very clear about where you keep them, where you lock them up, how you use them is as good as we can get at the moment.
Thank you, Andrew. Andy?
Yeah, a few questions, if that's okay, Fabian. Andrew, on your scheme, it sounds like you're doing a lot of your brilliant stuff there. What partnerships do you have on a national basis with stakeholder organisations, like you say, Cycling UK, for instance, and what work has been done, if any, to sort of communicate the sort of best practices? Sounds like you're developing, maybe to the wider employer base. It just sounds like you're doing a lot of great stuff, but I'm not sure that necessarily that gets communicated out. On the 3 bikes, we might want to go into detail here, but I'm interested about the robustness of the evidence and the evidence based, the methodologies behind the development of the cost benefit ratios, because whilst it's quite easy, well, not easy, but whilst we'll talk often very enthusiastically about those ratios, about the impacts of various schemes, there is often quite a gap between the evidence base that a given scheme might generate on a pilot basis, utilising desktop studies, and what Treasury will actually accept as something which is a viable business case. And then just on the e-bikes, I think for a lot more communication we've done on this, but it's this idea that e-bikes per se represents a risk. It's illegal e-bikes, represents a risk. Formal e-bikes that meet the standards are affected by nothing's risk free, but there is damage, and it's a simple binary situation. And the fact that your fire officers or whatever might not be getting that is a bit disappointing, frankly. So that's my
We have, before I ask you to answer, we have in a previous study by this group looked at e-bikes very, very carefully, and Andy is absolutely correct that anything that is bought through a legitimate, a respectable retail outlet by a manufacturer that's known is pretty safe. Those that have been illegally modified or bought through grey channels or imported illegally are the ones that we should worry about. So yeah, it's quite binary. Who wants to come in first on Andy's? Julian, yeah.
Yes, so in terms of this evaluation, we're not marking our own homework. This isn't the network of partners. We've had an independent evaluation by the Voltaire Economic Consultancy, Perspective Consultancy. So they have used state-of-the-art tools for estimating benefits. Interestingly, we had a parliamentary launch late last year, and they spoke and highlighted.
the strands were out as well.
Yes, yeah.
Yeah.
So hosted by Lord Watson of my Forest. And what they highlighted was actually the results in the reports are at the conservative end of benefits. So they have used tools that are consistent.
Yeah, I had a chat with them then, and still couldn't quite get to the bottom of the methodologies used.
Yeah.
Is it in the report?
It'll be in the report. I mean, there's a technical report behind that on our website that you can access.
Okay, that's helpful then.
But essentially, they use the active modes appraisal toolkit, which is to DFT standard. So basically, everything in the report is green book standard. So it can be used, but we've got technical report and appendices behind that. So we've got all the detail to share with anyone who wants help and support the business.
What was the sample size,
So it's basically mostly using the real data from the schemes.
Yeah.
So Big Birmingham bikes, there were 8,000 bikes, just to give them 500 away now, and in Essex, 4,000. So not all of them would have been tracked, about 2,000 in Essex. So a significant sample size.
Okay.
Anybody else want to come back on? Andrew, do you want to come back?
Well, I'll come back on the questions that you asked. Thank you for those. I think two parts of the questions that you asked me. The first thing is about stakeholder organisations. So I work very closely with Active Travel England and with National Highways as national agencies in terms of engaging with them, understanding how we can work together more clearly. And I'm forever lobbying them about, can we do something about the LC whips and can we push that along? So they'll be fed up at me by now. So that's on that side. In terms of engaging or liaising with other businesses and trying to share some of this best practice across, yeah, we work through ModeShift. So we do a lot of work with ModeShift on that side of things. Do we do as much as we could in terms of sort of sending the message out to other businesses? Perhaps not. But I think, notwithstanding the situation around NHS England at the moment, that is something I'd love to do. But, obviously we do what we can. In terms of the e-bikes and the modified and illegal e-bikes, absolutely. Your point is well made. Talking to colleagues in Brompton not long ago, they said they've never had a fire of one of their bikes, and I think we get that. I think the challenge is where you are presented with people who are very risk averse, and as I said, the NHS is so it's site by site by site. So a fire officer in one place might say something, but a fire officer in 10 other places will not. So that's been my experience anyway.
Yeah.
Karen, do you want to come back on anything that Andy asked? You don't have to.
I think in terms of stakeholder engagement, I'd like to see greater collaborations at borough level, certainly in ICS level, because it's something that has to be addressed through a neighbourhood. A lot of the staff move about a lot from NHS Trust to NHS Trust. The patients also go across boroughs. So in terms of being able to provide something that works across the neighbourhood and wider, that's really important. And infrastructure as well is really important. We've got a very good understanding fire safety officer, so we're looking at how we can manage it rather than get it up. But it's about setting up that infrastructure across so we can be more agile, I suppose. So there's a lot of work to be done there.
How far do your bikes go on a charge?
So I managed to go 10 miles to one place, to Bromley from Greenwich, and then back comfortably on a charge, but we don't have spare batteries.
Right.
So we offer that as part of that. So if a member of staff wants to go a long distance and felt some sort of, wanted to the assurance of having enough battery, then I'd recommend they take a second battery just in case.
Right, but generally 20 mile, that's what someone needs in a day.
Yeah, so obviously there are, you know, the manufacturers say 40 miles, but then we say here's your,
Yeah,
you're looking at
sure.
elsewhere.
That's what I found.
Andrew, just quickly,
Yeah, just briefly, just the other thing that just occurred to me is around the use of public e-bike and bike schemes. That's quite common, increasingly common in the NHS where they exist. So basically giving discounted or free access for travel for NHS staff to get around about using the multitude of different companies that there are out there.
Well, just a quick follow-up question.
very quick, because I've got lots of people online who want to ask.
Actually, maybe after, but very positive report, but didn't say much about the barriers that you might have encountered in people not wanting to take up the scheme or not wanting to fully use it. Not feeling safe on the roads, for instance. Is there a separate any work we've done around that about barriers and how to address them?
In terms of the people who could participate, don't want to. Yeah, so we have a philosophy of sort of meeting people where they're at, and some people face significant barriers and multiple barriers. So the community schemes that we set up in the areas often just start with conversations and trying to encourage people. Sometimes you need to get people literally walking a bit more before they're even willing to contemplate getting on a bike, and then it's about building their confidence through cycle training and doing it in a way that they feel safe and happy with.
Be a lot of useful learning. Thanks.
Before we go online, Ollie, is there anything you want to ask before I go to the?
No, very happy to go online, Mr. Chairman.
Okay, Adam. Right, our first question then from Mark Strong. Can you read it? Do you want me to read it out?
Oh, that's fine. I think it's best if you read it. So
Okay. I attend the liaison group for my local hospital, Royal Sussex County Hospital in Brighton. Its remit includes the physical environment in and around the hospital, especially how it affects residents, for example, waste and deliveries to and from the site. It's hard to get the group to prioritise active travel, not just by staff and visitors, but also by people living and working around the hospital. The last meeting was mainly about noise from the helipad. How can this be changed? And can we have details for Oxley's, please, says Mark Strong. Do you want me to take three at a time, or do you want to come back on each question? Yeah.
Yeah, 3 at a time's fine.
Yeah, okay. Can we just get the next one then from Ben Foley, Wheels for Wellbeing. We know Ben well, the Disabled People Cycling and Active Travel Organisation. Given that the segment of the population that can get the most health benefits from extra exercise are disabled people, and disabled people have more dealings with the NHS than the population at large do, what would be the next highest priority change after benches that you would make to increase active travel amongst disabled people? And that's from Ben Foley. I guess that's probably one for Andrew there. And then finally, third one, not finally, but the next one of the three, Charlie Wilson. Thank you to all the speakers, really useful presentations on the value of enabling active travel for wider health benefits. I'd be interested to hear more about how the schemes are monitored in terms of their behaviour change and effectiveness. Too often these kinds of initiatives are funded, but the resultant impact and scaling potential is hard to measure and therefore harder to justify at a national level. What kind of data is gathered? So let's go back to, is it Mark Strong? Yeah, Mark Strong. Who wants to come in on that? Anybody? Yeah.
Do you want to go?
Yes. I mean, I think this sounds like it's an excellent candidate for a new pilot for the hospital to try and develop a hospital scheme. And we'd be really keen to talk with all the key stakeholders about how we can put funding in place, share our learning and evidence to do that. And I think what's great about these schemes is it's not just about the benefits for the participants, for the individuals, it's the system change you can enable through that. And it's exactly the sort of issues that Mark raised. It's about trying to think about these challenges more holistically. So you do want the modal shift, but you've got to have lots of infrastructure components to think about that, how it can work with other agendas and other transport modes. So we would be really keen in having a conversation about how we can kind of promote this, our work to this sort of group. Yeah.
Karen, there's a particular question directed at you at Oxley's. Can Mark have the contact details?
Yes, absolutely fine.
Yeah.
Mark, please give ahead. contact me. Do you want me to say it out loud now?
Well, I don't know quite, what's the best way to do this? Shall
Mark
we?
can email me and I'll pass them.
Yeah, okay, we'll just data protection. Andrew, you're desperate to come in.
Desperate. Mark, thank you for your question. I want to bring up the example of the Christie Hospital that's in Manchester. And the Christie has developed a really great neighbourhood forum that's been going on since 2012 now, in which the board of the hospital trust, the sustainability leads, the property leads, the waste leads, etc., meet. I think it's 3 times a year with any local residents who are surrounding, living in the area near to the hospital, and with the local councillors for that area as well. And it allows the hospital trust to share with local residents what's going on now, what their plans are moving forward, and to cover issues like parking, active travel, etc. Thank you. In response, who was next? I think Ben Foley.
We were into Ben. Yeah.
We were the wellbeing. So you make a really great point there, Ben, and we've done some good work with Wills Wellbeing in the past. And I think that definitely undertaking studies or undertaking a kind of audit of our sites and the way into our sites makes a huge difference. Just things like, how do you get into the bike sheds, and is that access something that a person with a disability could do? Has it been proofed? Have we checked all of that stuff? And sometimes, as I say, a bit like benches, it's not the measures that will cost megabucks, but they will make a lot of difference to a lot of people. And then the final question was from Charlie Wilson about, I think, monitoring and evaluation. Absolutely. In terms of our Step Up in the Gear network and the work that was done with those interventions, we have carried out monitoring and evaluation of all of those, which meant collecting and gathering data for the 2 years that those formal interventions were studied. And I think you're right. If you don't evaluate, you don't learn, and you don't build on that, and you don't work out what you need to do next, well, yeah, you're right. There's a massive gap.
Anybody want to come back on the last 2 questions?
In terms of monitoring and evaluation, that's the fundamental part of my role, actually, is to try and ensure that we're collecting the right qualitative and quantitative data. So it's really important that we have the GPS trackers and the app as well to collect data, but equally to supplement that with survey data, as well as things like focus groups and meeting participants and intercept surveys, so we can build a very rounded picture of how people use the bikes. And we can use that to make cases for further investment, because absolutely we would love to have a national scheme, and we do really need that data and evidence, insight, and storytelling as well is very powerful. If you look on the website of the Active Wellbeing Society, you'll see some good information and some videos as well. It'd be great to speak to you as well.
Karen, do you want to come back on?
Sure. I mean, I suppose what would be great to address actually is the designs of outdoor spaces in and around the hospitals and the healthcare sites. If you design for people in wheelchairs, you're going to design for everyone. Good access, good infrastructure. So I'd say arguing for that, and this is more about just about a hospital or a healthcare site, it's about partnerships with local authorities, highways, local residents, etc. So we've got to get that right, and we need to make these healthcare sites an example of good health rather than fixing health. So we're looking at the long-term outcomes there. I think I second what you said about disabled access. When I was looking at some good quality infrastructure and design for charging and parking facilities, I saw that there was a ratio of how many cargo bikes parking there should be per number of patients, or how many cycling storage facilities should be per number of patients or per staff. And there should always be a space for a large cargo bike or something that could accommodate wheelchair users. I do know someone who did try to wheelchair bike from Greenwich down to central London, and it was a bit of a challenge, and I don't think she got the support that she really wanted to have. So definitely more on that front. In terms of the metrics, we look at the booking app gives us a number of registrations, number of bookings, and mileage undertaken by the bikes. We've been able to look at when the cycling occurred, and we can see on a monthly basis what are trends and when they are being used and not used. We also work with the team from the pilot to look at their business, the budgets, and we look at the information data to look at the number of patient contacts. And so it's a very qualitative feedback as well from staff. So it's a very small study, but we'll help you to scale.
Thank you, Karen. We've just about got time for the last, I think the last three questions, or at least the next three questions.
Yeah, I mean, we've got, I don't know if you've got to rush off.
I've got to rush our meeting, so I'll be in 6 minutes.
Okay.
So can
let's spin through them then.
Let's spin through. So Elsa Robinson asks, thanks for the useful presentations. The discussion so far has focused on NHS staff. Are there any reflections or knowledge to be shared on recommending active travel for patients and as a way to manage and prevent ill health? For example, through social prescribing, physical activity, clinical champions, etc. Joanna Flint wants to know, were the dash bikes procured through a framework agreement? Does the need to use a framework to procure bikes present a challenge to the NHS trusts? And then Benjamin Smith, it's great to have heard cycle training and/or partnerships working in all of the presentations. Really shows the importance of adult cycle training. It would be great to see this increased to many more sites. How do panelists and ministers see this being achieved? And then Michael McSherry, we've got a load more, have we? Okay, well, you don't all have to answer all the questions. Mike from London Cycling Campaign, LCC have been working with several trusts on a mix of staff and patient projects, including cardiac rehab, paediatric neurodisability, GP-based social prescribing and general stuff. LCC also have a separate relationship with staff who are advocating for cycling independently of the trusts. LCC would welcome more conversations with stakeholders as can be ad hoc across the 4 ICBs and trusts. As Andrew said, NHS behemoth, so formalised stakeholder engagement might be useful. Are there any plans around this? And then Leanne Coatman, in reply to Charlie Wilson, any trusts that are using ModeShift STARS platform, data is collected via staff surveys, as well as having all the travel initiatives and the travel plan per site information stored. Survey can compare your modal shift. I assume that's your, not your. That's more of a comment and reply to Charlie. So we've got 4 questions. Shall we go back to Elsa's? You don't all have to answer all of them, but let's go from Andrew back to Julian. Andrew.
Okay. So very quickly, yes, Elsa, there is quite a lot of work done on that elsewhere within the NHS already. We are increasingly now working with the primary care sector as well, because clearly in terms of social prescribing, that's where it starts. So things like working with Parkrun as an organisation to get more people running or even walking, because you can park as well. So we're working with a group of trusts in York on that. So I think that's that for that question. In terms of one of the questions that was asked, I think by the guy from the LCC about stakeholders, formalising stakeholders. Yeah, there's nothing to stop London Cycling Campaign having a more formal arrangement with its ICBs. You just need to be appreciative of the fact that the NHS isn't, organisation writ large at the moment in terms of ICBs, but also in terms of NHS England is in a state of flux at the moment.
So what ICB is?
Sorry, Integrated Care Board. Sorry, representing an
But it's another 2 hours for you to actually explain what it is.
Sorry.
No, it's fine. No.
All
the time, so
yeah. So I don't know, colleagues want to pick up on the other.
I'll just add a quick comment around public health, if that's okay. I think walking is such an important part of public health. We've had patients coming to forums saying that by walking 2 hours a week, they lose weight and actually improve their well-being. So a really nice anecdote. And then recently, speaking to dietitians, said that actually they're struggling to manage the caseload for podiatry. So we're seeing a huge impact of podiatry from car-centric culture, because people are walking less, therefore their wounds on their feet are much deeper, much harder to solve, and then they're sort of Yeah, anyway, it has an impact on the NHS.
Thanks.
So there's that. And in terms of the dash right, I understand that salary sacrifice is outside of any frameworks, but I think we were starting to look at that and haven't concluded that conversation.
But I'm sorry, we're racing through this, but I really need to finish in a minute. I'll leave the last word with you.
Yeah, I mean, active travel has huge potential to reduce the burden of disease and prevent ill health. But if you focus on people in the most deprived communities by removing the barrier of affordability, that's scaled up even more.
Thank you very much indeed. 30 seconds each, just to conclude. Andrew?
So I would
You don't
say,
have to.
no. I think it's a brilliant opportunity to get more people moving in terms of fitness, in terms of health, but also in terms of the environment. And I think actually investment in active travel and focus on active travel is something that should be continued. And I welcome the outcome of the consultation that came forward recently from government in due course.
Thank you, Andrew. Karen?
None of that. I'd love some more help on misbusting around the safety of travel and the ageism that goes with it. It's very, very beneficial for people. All of us.
Somebody wait at the next meeting. 1 second.
And the systems don't work in isolation, so they all need to connect and work together, whether that's the NHS, transport, health and community. If they all work together, then there could be potentially much greater benefits.
Thank you all. Thank you to our three panelists. Thank you to all MPs who've taken part. Thank you to all of you online for being involved. I'm afraid we have to conclude because somebody's waiting at the door. Our next meeting is in person only. Sorry about that to everyone online. Takes place on Monday, the 9th of March at 16:30, where we'll be hearing from Lillian Greenwood MP, the Minister. So thank you very much for your